So after deciding upon whether we need to operate the patient, whether the patient is ready for surgery or not, and after undergoing all those delegations, we finally come to the planning stage. And planning is one of the most important points in orthognathic surgery. So my question would first be to Dr. Utkarsh. Probably a few years back we were doing our planning in a different way. Now we are doing our planning in a different way. So I would like to point out about the traditional approach to treatment planning, like using the casts, etc., manual method basically,
Right.
versus the modern method or the using of computer virtual surgical planning. So can you tell us the difference between the two approaches, since you have been an orthodontist who has seen the transition from the manual to the modern approach? Can you elicit the difference between the two? What are the advantages and disadvantages of the two of them? And what are the benefits that the patient achieves from going from traditional to modern planning?
Sure, doc. Sure.
Yeah.
So a few years back, what we used to do is, when we had, of course, after proper diagnosis and assessment of the patient, what we used to do is we used to ask the patient to get some radiographs, lateral cephalogram. We used to trace them, we used to make some cutouts, we used to adjust them on the film and try to just match their bite, whether so much of advancement will be better for the patient, will be better for the looks or no. We used to make some models, take some impressions, cut the models, like, a mock surgery in our clinic, just to be sure that treatment result, surgical outcome would be better if we do it in clinic. But now with recent advances, we can incorporate the scan of the teeth, the scan of the bones and the soft tissue all in the software on day one while preparing for the surgery. We can plan, discuss and implement this treatment objectives to get a more predictable result. So with these modern softwares, virtual treatment planning could be a reality. I think Dr. Parit would elaborate more into virtual surgical planning and how better we can get more predictable outcomes, surgical outcomes with those softwares.
Right. So basically, with the advent of virtual surgical planning, we can do a much more and avoid all the manual tedious tasks that were happening before, like how sir has mentioned. So my question next would go to Dr. Parit about virtual surgical planning. So what are the advantages from your perspective, because you have been doing virtual surgical planning for over 5 years now? So what are the advantages, what are the benefits, and what is it that you can describe to a patient and they understand things in a better way, and how has use of virtual surgical planning improved the accuracy and execution of your procedure?
Yeah, so with modernization of the world, definitely in medicine also we should upgrade and we should make ourselves more predictable. So virtual surgical planning is one of that tool mainly used for the orthognathic surgery or corrective jaw surgery. First I'll say we need few data which may not be advised earlier to the patients, like as Dr. Utkarsh said, that in conventional planning we advise we advise for the lateral cephalogram, a simple 2-dimensional X-ray and some dental models. But for the virtual surgical planning, we will need a CBCT or the CT scan of the face. We will need intraoral scan, and we have to feed all the data along with the patient's photographs, mostly the calibrated photographs. So we can have patient's millimeter by millimeter calculation of all the jaw bones, the teeth positions, all the relative positions for the structure which requires the correction. So we have major information in comparison to the conventional method, and apart from that we can visualize the jawbone 3-dimensionally, and also we can accurately repositions the jaw in 3-dimensionally. All the planes we can control, and the greatest advantage is that we can have some simulation understanding and we can have some prediction about the patient's result. So definitely this will improve the accuracy of the surgery, and after repositioning jaw to its accurate position, we have all the measurements which we can cross check during the surgery whether this point has come properly in that particular position or not, like the vertical height and the sagittal advancement. So we have all the values available with us. So, and in case we are going to face any challenges for repositioning of the jaw, we are aware beforehand only. So we are well prepared to handle such kind of a problem. So definitely VSP has a great advantage, and because of the VSP we are able to get the predictable or planned result in an accurate way. So definitely VSP is highly recommended for planning any orthognathic surgery today.
Right. So very important point, that traditionally, like how we used to plan our cases, that used to be based on the dentition or the teeth. So initially we used to treat the teeth, now we are treating the face. So patients who are looking for surgery, do check up whether you have virtual surgical planning done for your case, and whether your doctor or the surgeon is able to show you the results, at least give a brief idea or give a gross idea as to how your face might appear post surgically.